Hi, welcome back. I'm Erin Bina, and this is episode 6 of our vlogcast, Clinical Virtual Assistants at the Point of Patient Care. Today we want to talk a little bit about how comfortable we are with advanced AI learning about us and how we work. So I want to ask our panel, what if a virtual assistant could learn from you by following your clinical decision making? Would you begin to trust it to make suggestions for you?
I think for routine tasks and routine schedules, a bot can do almost anything. I mean, you know that they come in, they ask these questions, this is what they do, then they go document or whatever their workflow looks like. People get into these habits. So habitual behavior and what you could do to support that habitual behavior. But not every person in a category, whether clinician or nurse, has the same habits.
I suppose more as a reminder, oh, have you thought of doing this, or you haven't looked at this page, or something that might be relevant. I wouldn't have any objection in being reminded.
Maybe over the last week, there's been an influx of flu cases in my hospital and I am not even aware of it. How amazing would it be if the bot could sort of let me know, hey, you have a patient with respiratory symptoms. There's been an uptick in flu cases in our hospital over the last week. Please take that into consideration.
And I'm curious, is there anything else you would like a virtual assistant to anticipate or sense?
Something that could really distill down what's truly useful in terms of harvesting all that EHR data and presenting either a warning to you or some sort of actionable information.
If you practice medicine long enough, you encounter situations where the patient might actually be sicker than they appear to based upon their vital signs or other diagnostic information. And if there's an application for machine learning and a virtual clinical assistant to find patients who might be sicker than they appear based on these other metrics and then alert us to that, that would be extremely useful to us.
I think there's tremendous potential for a personal assistant to help me practice better medicine. And I think that has to come with humility and an acknowledgement from a physician that I don't know it all. I'm not a perfect physician. I will make mistakes. I can't know all the information at all times. And I think that I can give a laundry list of areas where I want a personal assistant to help me do my job better.
Thank you. Those were some really neat ideas on how a virtual assistant could help in your personal practice. Coming up, we have the final episode in our series. We'll be taking a closer look at creating the perfect virtual assistant. I hope you'll join us. Thank you.